it all starts with outcomes. And as the cost of healthcare continues to rise, everybody's looking for solutions. And they're looking for opportunities to control their costs within their health plan. And I do think as you look at the marketplace, people look at captives as a really viable, strong solution to do just that. And so it starts with the outcome in mind, the pain point that a lot of employers have, and this being a solution to help solve their challenges.
Hi, and welcome to Captivating Health Insights. Today we're doing something a little different than our typical podcast style. We actually have a live event here at our headquarters, and we are talking about the future of captives and stop-loss leadership. And with that, I'd love to welcome our guests. All right, well, let's jump right in. I'm super excited to introduce our panelists today. My name is Maddison Bezdicek, of course, host of the Captivating Health Insights podcast, and we're going to start with Steve Gransbury. Would love to get to know you a little bit, and I want you to share your captivator with me, Steve. Okay. And so, just so everybody knows, what a captivator is it's something that is captivating you about our industry lately. So that could be a stat or a story, anything that's captivating you right now. Would love to hear what yours is.
All right. Several captivators, but I'll try to narrow it to one or two thoughts. Steve Gransbury. I've been in specialty insurance for 30 years, maybe a little bit over 30 years. Most of that time in the A&H space, most of that time in medical stop loss. I'm president of Health Solutions here at Captive Resources. So all of our departments, whether it's our market-facing team, our internal operations, our underwriting team, our team that works with our members in terms of vendor solutions and cost containment, all those departments kind of roll up through me and our leadership team. In terms of a captivator, I think that, what I'm really encouraged about, and I think the great opportunity that we all have in this ecosystem of stop loss and captives, is the opportunity to work with prospects and members and work in terms of cost containment, right? To partner with them with ideas and insights to help them control their costs and abate trend. It's interesting, this time of year, there's always some studies that come out, right? Whether the major consultancies or some of the think tanks will come out and they say, there's a couple of headlines in the Wall Street Journal. This is, the biggest rate increase that employer groups should expect over the last 15 years. There was a Watson study that came out that indicated that more lines of coverage in A&H, specifically stop loss and TPA and PBM, that business will be available and actively shopped this cycle. And so what I think about is just the sheer opportunity that affords us in this ecosystem. And specifically when it comes to the captive design and captive stop loss, the opportunity to share some stories and insights around member-led initiatives. Whether it's work groups, whether it's engagement with CFOs and HR professionals, the opportunity to work with peers to be able to identify problems and challenges and collectively come up with solutions. And more often than not, in the captive stop loss space, some of those ideas and solutions are really first dollar. If we think about the risk design of captive stop loss, it's excess, but I think the solutioning and the opportunity is really at the first dollar level. And so I think, what captivates me is the sheer opportunity that affords us.
Awesome. Thank you, Steve. Tara, would love to hear yours next.
Sure. My name's Tara Krauss. I am the president of Accident and Health for QBE North America. I am a career underwriter that ultimately worked my way up into this position, and I'm approaching the 30-year mark. I'm not as old as Steve.
Well, no.
So I'm pretty much responsible for the strategic priorities and the profitable growth of the Accident and Health team. Everything from the people, the portfolio optimization, and our performance rolls up to me. And my captivator is just due to my personal interest is the climb and the spike we're seeing in cancer diagnosis in the younger generations. That 15 to 49 age bracket is seeing an alarming trend of increase in diagnosis. I'm sure everybody here knows someone young that's been affected, and it is kind of growing at an alarming rate. When I looked at the statistics, we're about 10% higher in diagnosis rate than we were in 2000. So what's contributing to that? I think, obviously this is the insurance space. It can be a little bit boring, but I have a lot of interest in kind of what's happening with our healthcare system. And I think we need a paradigm shift in moving from this sick system that we've built to a well system. And it's a long runway to get there, but that's what most compels me and motivates me to do this job.
Awesome. Thank you, Tara. Jay, you're next.
Okay, thank you. First and foremost, thanks for having me. My name is Jay Ritchie. I'm the president and CEO of Tokio Marine ACC A&H Group. Much like Steve, I have been in this business for over 30 years. I can track it back to the last century if you really want the right metric. But I've got a really diverse background. I started in this business wanting to be an actuary. Not as smart as Brad, so I'm not an actuary. I went more into underwriting. But I've also run legal compliance departments for self-funded plans. I've done a lot of industry work. So I think I've got, and I usually tell most people I'm associated with, I know enough just to be really dangerous. I'm not an expert on anything, but I'm knowledgeable on a lot of things. What I think of my captivator, I think from my perspective, it's perspective. What are we doing from perspective? I usually quote that I see as a catastrophic medical reinsurer, I see the 2% that goes wrong, not the 98% that goes right. So remember, most of the stuff that I see, it's been a bad claim. It's a burn, it's a preemie, it's a transplant, it's something bad. I don't get to see the claims that are, hey, everything went perfect, they had great medical care, everything was just, and it came under budgeted cost. That doesn't exist in my world, I don't see that. But because of that, I sit at the end of the line. I see the admin, I see what was done with the networks, with the care, and that's where I always say I see what went wrong. I sit at the line and I can see where the line bends. Yeah. So what that gives me is a perspective to look and go, hey, here's an opportunity for improvement. Hey, here's something else we could do. So much like Steve said, in that really this is about how do we impact first dollar claims before we can really impact stop loss claims. So we get a unique perspective on what can we do. And that's actually where I'm excited about the industry, excited about captives and what we can do just to impact things before they actually explode and actually deliver better care long term. So thanks for having me.
Thanks, Jay. Last but not least, Brad, I'd love to hear from you.
All right. Well, good afternoon, everyone. I'm Brad Nieland, President and CEO of Berkley Accident and Health. And I want to start just by thanking you, Maddison and Steve, and just the rest of the Captive Resources team for inviting me for this and putting this podcast together. And Tara and Jay, it's great to join here with the two of you as well. So when I think about my captivator, right, what really truly captivates me, and look, in this business, it's easy to get lost in the mechanics. But we also always have to remember the ultimate goal, which is high quality, affordable healthcare. And one of the things that I like to think about that really motivates me is that when a self-funded plan has a good outcome, that creates a great outcome for American families. And that really is the ultimate goal and what we're here to do. It is to provide high quality, affordable healthcare. And there's really no better reinforcement of the importance of that than the US government being shut down today. And if you think about the reason why it was shut down because of healthcare and affordability challenges that we have in healthcare today in this country. And so just always remember, a good outcome for a self-funded health plan is a great outcome for American families. And that's really what motivates me.
Yeah, I love that. And I'm super excited about this conversation. And we're going to get into kind of the nitty gritty and all things stop loss and what's in our industry today. First question is for you though, Steve. Okay. Just baseline, what is stop loss? Why is it so important? And what are we seeing as far as trends in the market today?
Yeah. You can't self-fund essentially without medical stop loss unless you're a very large group, right? So it's the financial backdrop for a group to be able to have risk transfer for large claims, right? If you're a group that's over 75 or 100 lives or what I call middle market, 200 to 1,000 lives, I think that it's pretty well established that self-funding your employer-sponsored healthcare is the better financial mechanism in order to control costs and have a value proposition and a plan to your employees and their dependents that's worthwhile and really well regarded. Without stop loss, groups can't can't absorb large claims. They need risk transfer for catastrophic claims, whether they're preemies, whether they're certain types of cancer claims, whether they're infusion therapies. Large claims are expensive, and groups can maintain the value proposition of good healthcare if they have risk transfer. The challenges in the marketplace, and this is beyond stop loss, are pretty unique. Some of us have been around, maybe all of us have been around long enough to see market cycles, work through stop loss, where you have capacity that shrinks, and that means like less, carriers that are in the space. When capacity shrinks, usually rates increase. That usually happens on the heels of large claims or bad claims, right? And if you look at some of the reporting that's come out over the last month or so, stop loss is the highest loss ratio probably ever recorded, I believe. We're talking about mid-80s loss ratio. And that's been on the increase over the last couple of years. I think that as a marketplace, we hit 79% or 78% maybe 4 or 5 years ago. And it's been ticking up, right? So the challenge is to make sure how our partners at the end of the line, the insurers and the reinsurance, they have the ability to turn it on the running profit to maintain availability and maintain access to stop loss. Because without stop loss, right, it's very difficult to self-fund, if not impossible for some larger groups, or excuse me, for some smaller groups. And so, to bring that, and maybe this links to my Captivator as well, is that there's a great opportunity working with groups to be able to navigate I was going to say landmines, there's certainly some of those out there, but to be able to navigate this environment. And if you look at the increases in the marketplace right now, the Wall Street Journal article that indicates that rates are going to be the highest in the last 15 years. The Willis Towers Watson study that just came out, and the expectation is that groups will be not just check bidding, but 58% of groups expect a change in service providers after this 1-1 marketing. So that could be TPA, that could be PBM, that could be point solution, it could be broker, it could be carrier. And so groups are past the point of saying, like, I'm going to cost shift, right? Just to be able to manage these costs, I'm going to increase deductibles, I'm going to increase copays, and pass the savings, or pass the increases off to their employees and their employees' dependents. I think we're past that because it's about sustainability of benefits, a good benefit offering, and also making sure that the employers can offer something that their teams value and associate with a good employee experience with their employer. So the opportunity is that there are enough levers and there are enough expertise in the marketplace to be able to work with those members and to come up with solutions and ideas that makes their health plan more sustainable. Really lines up to what Brad said, right? To make the American family have a good experience with their employer-sponsored healthcare. And so I look at the marketplace, right? And I think that we have the headwinds of maybe a consolidating market with larger loss ratios, which means more rate needs to be passed through the system. We have carriers that are entering and exiting, so we have capacity shifts. We have the cost of healthcare, which is at a significant pace of increase compared to last year. We have more utilization, like more people utilizing or using their plans. But we have all these levers, and captive stop loss is chief among those, to be able to work with brokers and to work with employer groups to say, okay, let's back up a little bit and say, have you looked at your PBM arrangement? Have you looked at your point solutions? Are we really good with the networks and the plan design? To Jay's point, really managing those plans from a first dollar perspective, even though that the risk design of captive stop loss is excess. So lots of headwinds, but plenty of tailwinds to be able to work with groups and service providers to manage those.
Yeah, I think that's an awesome baseline, and I want to dig into that a little bit more, especially with what you said, Brad, about the outcomes of healthcare impacting basically almost every American family. How do captives help employers protect their employees from those affordability changes while also keeping their costs in check?
Yeah, no, definitely. So I'll start first by saying that joining a captive can really be a powerful step for an employer that wants to lower the cost within their self-funded health plan. And so employers, when they join a captive, at the end of the day, they're joining a community and almost a collaboration framework that allows them to better understand both what are best practices, but what are new ideas around risk management? What are things that they can do to lower the cost within their health plan? Can they dig into the data and identify what the cost drivers are and then pinpoint those and identify strategies to really hit at those various cost drivers. And so within that collaborative framework, there's a lot of power there for a self-funded employer. In fact, at Berkley, we have captive programs that literally have negative first dollar cost trends. And that's within the entire program, and it's based on this engagement and this framework and being able to work and develop risk management strategies to improve the cost within those programs. And I would add too, there are dozens of examples, at least that I've personally been involved in, where employers have been able to either lower the out-of-pocket cost for their employees or keep the out-of-pocket costs where they're at for an extended period of time. And that's really where the win comes in. And back to American families, if you're managing a self-funded health plan and you're able to either lower the out-of-pocket costs for employees or keep those out-of-pocket costs flat for an extended period of time, that's a real win. And I think that's the opportunity that exists within captives.
And going to you, Tara, I know QBE recently released their 2025 Market Trends Report, and there's explosive growth in specialty pharmacy, high-cost claims. How do you think captives can help with the exploding costs, and what strategies can employers deploy to help mitigate some of those risks?
Sure. We're seeing an explosion in $1 million claims where that used to be rare. There's not many groups that don't see them. Those claims have almost doubled on our portfolio in the last 4 years. Circulatory claims have seen a spike of 60% on our book since post-COVID. So I think there's a couple things that captives can do that's different than a traditional self-funded plan. They have the ability to pool risk, right? So they can work with other like-minded employer groups to kind of try to deal with the severity volatility on those large claims that I mentioned, but also the aggregate claims that they might be dealing with that we don't necessarily get impacted at the excess level, but employer groups are definitely feeling the impact. Like think of the GLP-1 trend this year and how that is affecting the first dollar claims and the overall healthcare spend. So that pooling element, getting like-minded employer groups together, being able to kind of level out those peaks and valleys. Also, if they're in a member-owned captive, then the year-over-year volatility can be leveled out. Usually they're in it for the long run. They're not hopping in and out contractually every policy year. They can look at things differently than this transaction every 12 months. They can invest more time with like-minded individuals. PBM's a great example. They can really study the trends if they can get into more data visibility. So if they have the ability to kind of look at the data and break it down and look at where the trends are, then they can put the right cost containment solutions in. PBM's a great example. Who's getting the rebates? Where's the site of care happening? What's in the formularies, for example. So you can put in a formulary, but if it's not impacting that particular employer group's actual trends, what good is it? And so I think that captives are a solution for employers. And different employers might be interested. You might have an employer group that's running really well, and they're feeling like, wow, we've got great experience and we're giving our profits to a commercial carrier. Or you might see another group that isn't doing well and they're getting hit with these increases year over year and they're frustrated with the trends and they keep kind of, whack-a-mole, putting different solutions on and not getting much impact and feeling that burn. And so coming together and with like-minded and saying what's worked for you, what can work, can I look at this group more holistically is huge.
Yeah, and I think in that same vein, Tokio Marine HCC also put out a recent report. And it was interesting because I think that was showing more increases in large severity claims, over $2 million claims. So same question to you, how do you see captives helping mitigate those types of risks that you're seeing there?
Well, let me first talk about the data, then talk about the captive solution.
Great, okay.
What we've really seen is more of a barbell effect. And when we look at stop-loss claims, we've seen an increase in the frequency of claims in the $200,000 to $500,000 level. But then we've seen an increase in the excess of $2 million. Our $1 million claims are actually fairly flat from prior year to current year. But those big ones that are happening, they're really being driven by a couple categories. It's really being driven by children under 10. If you look at it, if we look at our data, it says children under 10 are 14% of our population, but they represent 40% of the claims over $1 million. And if you start putting that over 2 million, over 3 million, and over 4 million, it becomes almost exclusively the entire claims pool over $4 million. Now that's NICU babies, preemie babies, the care is warranted. You know, I would not argue with anybody's children's hospital about proper care. It's not gonna happen. But what we like to see is just how do we start working through that? And when we talk about what can the captive do, I always look at a captive as, I think of it as a large self-funded plan on steroids. So if you look at a large self-funded plan, you've got, all right, they've got their data, they can start customizing to what they're doing, but they've got one risk manager. Where when you get into a captive program, you actually have every member employer is now one of your risk managers. And when you can start aggregating that data and getting that first dollar data together and start looking at, hey, here's a hot spot. So think of it like a game of whack-a-mole. All right, hey, claims are popping up in this area. What solution can we engage and deploy to help manage and tap that down? Great. Then what's the next whack-a-mole? What's the next thing we can do? And I think that's the brilliance of the captives, because you get that commonality of a pool of employers who can come together and attack issues. And how do they attack them? They also have volume buying. I mean, they have leverage.
Buying power. Yeah.
Leverage is important with the vendors. There are vendors in our industry who go, oh, if you're not 1,000 lives, we don't even want to talk to you. Well, you tell an employer it's got 150 lives, they've got the same problems. Mm-hmm. Well, now we can go say, hey, actually, we don't have just 1,000 lives, we got 10,000 lives. So now let's talk about what we can engage in. Now let's talk about how we negotiate a deal that helps improve the outcomes for the plan. So that's where I think the captive is truly the magic of it. I think the future of captives is really robust. I don't think there's anybody on this panel, especially the three of us from the care perspective, who don't like captives and don't want to see them grow significantly across the industry. They've been really good.
Well, to Brett's point, though, they do run, historically, they are running better than the average industry. Yeah. So something is different. They're, what they're doing is working. They obviously have their own challenges, but they're outperforming the general market in stop loss.
Yeah, it's no longer a niche solution. I mean, captives are mainstream. They're growing every year. And I think they're being positioned differently, too. So, Brad, I'll put this question to you. I think traditionally, brokers may have been more on the defense in bringing in captives, and we're seeing a shift into bringing captives into the conversation more on the offensive end. So what have you seen and how those conversations are shifting from your perspective?
Yeah, so I mean, I would just simply start by saying, as carriers, obviously we want to grow. As NMGUs, we want to grow. But brokers, they also want to grow. And so they're looking at opportunities to grow within their own books of business. And typically what a broker will try to do, if you put yourself in the seat of a broker, they have to find a way to wedge themselves into a conversation with an employer prospect. And how do you do that as a broker? And typically they lean on what are the new solutions, the new ideas in the market, the new mindsets, the new solutions. And if you look over the last 10 years, brokers have kind of gravitated towards things like reference-based pricing and level funding, and conversations around PBMs, whether it's transparent PBMs or even just the topic of rebates. And now I would add group captives into that conversation in a really big way. And brokers, if you think about group captives as well, and you go back maybe 10 years ago, captives were new, they were unproven. And then you go throughout the journey of this new market and it starts to become, okay, hey, this is a proven thing, it works. And then you get to the point now where captives represent, a 4 to 5 billion segment of this stop loss industry, and it's a proven solution that produces really great outcomes. And in fact, if you look at the overall commercial insurance market, now this is beyond just medical stop loss, it's all commercial insurance. 25% of all premiums written through the commercial insurance market is in a captive arrangement. And that really speaks to it being a proven commodity and a solution that can be, harnessed and leveraged in a lot of different ways. And that's what really makes the market opportunity around captives just, I think, so promising for all of us.
It's a great comment. I firmly believe that the dominant structural the dominant structure for financing of self-funded employers, middle market business, say 100 to 500 or maybe even 75 to 1,000 lives, right? I think we'll look back and we'll see this concept of collaboration and risk share as the dominant, structural component of groups that self-fund in that middle market zone. Because it makes too much sense, right? It makes too much sense. If you think about there's an aspect of risk share, which means if I have a lot of claims, right? If I'm an employer group, I'm 150 lives, and I have more claims than anticipated, I have the opportunity to share that risk. If I have catastrophic claims or severity claims, I've got risk transfer to the fronting carrier. But I also have the opportunity to collaborate and work on first dollar claims and cost containment. I've said this a bunch of times. If you've seen one medical stop loss captive, you've seen one medical stop loss captive. But if you have the dynamic of member owned and member led, then I think you really get into the gold dust of performance, right? It's not, led by an independent, third party, whether it's a captive manager or whether it's a carrier. There's a lot of great solutions out there, but if you have that gold dust magic recipe of member led, member engaged with good service providers, then the conversation is really about what the groups want to talk about, right? And what do they want to talk about? They want to talk about PBMs. They want to talk about direct contracting. They want to talk about data and analytics. The opportunity to have a data and analytics platform with 100 or 200 or even 500 members of a captive, so you can get those first dollar claim indications and real time look at the captive performance and individual group performance by diagnostic category, is really beneficial because you can seize on those opportunities quickly with group buying power to make sure you have the right service partners in place to manage those claims. Because not all large claims kind of materialize out of the blue. If you look at cardiometabolic claims, if you look at certain types of cancer claims, if you look at musculoskeletal claims, hip replacements and knee replacements, they were all manageable events at one point, right? At one point, they were something that were manageable, that weren't catastrophic claims, that weren't stop loss claims. And if you have this member engagement and the right service partners around looking at the data and finding those trends and proof points, you can manage those so much more efficiently and quickly as compared to certainly first dollar arrangements, but even traditional stop loss arrangements, which I've spent the majority of my career on the traditional side. But if you have that member engagement and you have that opportunity to look at the data and see those claims before they're complex large claims and be able to manage those and have that bear out in the experience, I think that gives groups the best chance. It really does.
Can we dig in a little bit more there, Steve, in terms of captive member performance? What patterns are you seeing that's when it's going well, as far as when we're looking at those patterns?
Again, like I've spent the majority of my career on the traditional side, and we started writing captive business 20 years ago, right? And we in my former job, we wrote a lot of single parent business. We wrote a lot of group captive business as well that were specific to certain industries. And we always remarked that this segment of business just ran much better than our traditional stop loss. And I think that has a lot to do with the like-mindedness of the participants and the engagement around cost containment. And it's not a year-to-year. I think we mentioned it once before. It's not a year-to-year event when you're in a captive stop loss arrangement. It's a partnership, right? You're talking about managing renewals and being appropriate as opposed to the spreadsheet, actively marketing these things every year. And I think that when you have this engagement on cost containment, best practices, and ideal risk structures over a period of time, there are more insights and ideas and things get implemented at a larger scale and faster. And so you get a material impact on your experience over time. The captive business will just, as historically in my experience, has just run better. But I'm interested from your perspective. I'm sure you guys see the same thing.
Yeah, I'd like to comment on that because I think it really can be defined as it's a community. Because again, when we look at the employers who are really interested in the captive space, you can have the single parents that are out there doing their thing, but it's really that 100 to 500 life market. And the decision to move from fully insured to self-funded plan, and remember, we're one of the only insurance products that is unlimited risk. If you get a casualty product, it's got a cap, it's got a limit. Ours, by law, it's unlimited. Now, we've never gotten to those really, really crazy numbers like you can see in the P&C market. But I still think from an employer, they're looking for, if I'm going to go to self-funded, I want to do this, I want control, but I don't want to be a lone wolf. I want to go into a community, and a like-minded community that says, we're managing this, we're seeing what it is, what can I learn from each other? So that community becomes so important to the overall package, and I think that's why it delivers better results on average.
Yeah, and I would add to that, the like-minded community. I thought those were really great comments. But you also have the alignment of interest that exists within a captive, and I think that's particularly powerful. And so you have the alignment of interest, but you also have the long-term strategy dynamic to it. And it's the whole concept of, if you have a long-term strategy and you're working towards that strategy, it's going to pay off and it's going to have a positive impact, versus just the every year whack-a-mole that we always experience, in the traditional markets. And so those two aspects, I think, are also, very powerful.
And probably it's important to bear out when I think we've all have commented on the fact that the captive segment, runs better. But what does run better mean, right? I think you see less deductible changes, you see more palatable rate increases over time, and you see a loss ratio performance that's better than certain segments of traditional stop loss. And the loss ratio is in all the layers, right? It's in the gross layer in terms of how the program is running, but also the shares that the captive retains and the shares that the carriers retain. They run better over time if you have the opportunity to put in these first dollar cost containments.
And Brad, we go back to thinking about a new member taking that leap and moving from, like Jay was saying, moving from fully insured to self-funded. I have this community, you're in the door. What advice would you give for those new captive members to not just kind of be in the captive, but start actively managing their claims and controlling the future outcomes?
Yeah, definitely. So as a new member, let's be honest, there is work involved to participating in a captive. And so that work is to really roll up the sleeve and figure out what are the drivers within your self-funded health plan, and let's figure out tools and solutions that employer can use to really impact those costs. And, but one of the things I like to think about is it is work, but it's really worth it at the end of the day, because you can have such a positive impact. And so for me, as a brand new member, I always encourage them to focus on the highest impact items first. And those highest impact items are easily, number one, what is your PBM strategy? What's your strategy around rebates? Do you want a transparent model? What's the right approach for you, the customer, around PBMs? Number two, what's your data analytics strategy? Steve mentioned that earlier as well, around the importance of data analytics. And let's figure that out, and let's have a real strategy to derive insights from our claims data such that we can make that actionable and do something with it. And then third, it would be all things sort of TPA and network related. Let's make sure you have the right TPA. Let's make sure you have the best network that we can find, and focus on those three highest impact items first. Beyond that, there are a number of really positive and impactful point solutions in the market as well, but I wouldn't go there first. I think that's kind of a phase two once you get the big pieces right. I don't know if you guys agree with that or not, but that's how I think about it.
I think you guys have both made points about it's not autopilot, and sometimes a medical stop loss can be. It can be very transactional, and it's a small fraction of what that employer group is paying. So the employers that decide they want to get engaged in a captive really do need to be in it, right? They can't just set it and forget it. They need to be involved to impact the change.
But I do, and I feel obligated here to put a little bit of levity in this, of going, there is not a single employer in a captive who got in the business and said, ooh, I can't wait to start a business and manufacture widgets, and I really can't wait to dig into our health insurance and how I risk finance that. I mean, I hate to say, yeah, we're all the insurance nerds and geeks, we do this, but I think especially for the audience here and for just everything, you have to take a little bit of levity on that. That employer got into the business to do something different.
Right.
They're looking for expertise, they're looking for resources, they're looking for this. They don't want to go study insurance all day long. They don't want to read, hey, how's the best way to finance your medical plan? They want to know, hey, what are my resources? What can I learn from them? What can I get it quickly and efficiently? And how do I access that? Then I can go about to what I came here to do, which was build my business and run my business.
Right. Well, they need to hire people to do this, because unfortunately, they are responsible for the healthcare outside of the government plans, right? And so, and it is the number one driver to their employee costs. and it keeps growing. So that cuts into their balance sheet. So if they,
I agree that they're forced
they're
into
forced
this
to, yeah,
based on the
for
system.
sure.
So therefore, they have to pay attention to it because
Right.
it's usually the number 2 cost in their balance sheet. Right?
Yeah.
Well, and that's why I like to go back to the human element around it as well, because you have to appeal both to the CFO and the HR manager. And I love that human element because it can really have a positive impact on their employees.
I think it works well when they're both engaged,
they're both at the
right?
table.
One's looking
Yeah,
at the
I
numbers
agree.
and one's looking at the people.
I think engagement is a critical term here, because that widget manufacturer, probably the last thing they thought about was their health insurance, but probably the first thing they think about when they think about manufacturing widgets is the engagement and the happiness and the stickiness of good employees, right? Their employees will be better performers, their employees will be better engaged, and hopefully their employees will be better enabled if they've got a quality health plan that they can bring back to their families.
Let's go back to the data conversation. Tara, help us understand, I mean, most employers are looking for increased visibility into their data to be able to make these decisions. So how would you recommend, what advice would you give for employers looking to increase their visibility and transparency into their data?
Well, I think for a traditional self-funded group, they're getting monthly reports from their administrator. Sometimes that is, or most of the time lately, it is de-identified information, aggregated information. It is incredibly hard for a medical carer with clinical expertise, let alone an employer, to know, like, what is this data telling me? So I think, that data and analytics platform, looking at, population management and really getting into the nitty-gritty granular details of what the data is and demanding that there are some data and analytic platforms out there that the buying power of the captive allows them to access. And that's where you can really look at the trends that this panel's been talking about today to impact change.
Yeah, kind of think about humanizing the claims, like Brad was saying, the human element of understanding what's really going on in your data and the people. All right, Jay, I know that you're passionate about AI and the potential to sort of reshape data and stop loss in the future. How do you think captives are uniquely positioned to be able to leverage these tools in the future?
I would say, I am an advocate for AI and what I think it can do today. I would first got to say, I think there's a difference between where we are in society and where maybe all the consultants want us to think we are. There's machine learning AI, which I think is very strong now. I still think we're working on the dawn of generative AI. But what I think is unique, and it goes back to the theme that we've all hit before here of what does the captive do? If you get that first dollar data, what can you do with it? What can you model with it? What can we improve healthcare outcomes with it? Let me use an example. Diabetes is not an immediate onset condition. It has a progress. How can you engage that early, find it, and actually do something that benefits the member to their own benefit over time? How do I create an incentive for people who are at risk for certain cancers? How do I create that risk of going? And again, I always talk about this. So again, we're in the catastrophic medical business. You talk about, $1 million claim. Well, think about it from the members. We go $1 million claims are big claims. We have to deal with them. From the member, though, they've already hit their out-of-pocket. They've had a big spend usually coming up to that. What if we could impact them a little bit earlier and say, hey, if you go through this treatment plan or you go to this facility because they've got the best outcomes for your maybe forming disease state, we'll just pay you your out-of-pocket back. If it's that on top of $1 million claim, that's not going to be $15,000. Not going to be matter to us. So what can we use AI to drive member behavior, to drive better outcomes for the member, which will automatically create better outcomes for the employer, and then us down the road as a backstop. I think that's where I look for AI. How can we pull this data together? How can we find macro trends in the data? Maybe if it's one single employer, they're not seeing that, hey, they've got an increase on this side. And again, going back to my whack-a-mole, maybe it looks like a more aggregated book of data of going, yeah, this one employer has a little bit of elevation of here, but all those elevations start stacking up. Now it is something we need to deal with. How do we engage and prevent and deliver a better healthcare model? So again, I think someone mentioned earlier, we have a sick care system. And I agree with that. We react to treatment. We don't advocate for treatment. I also think that's where being self-funded has the biggest advantage. Being a self-funded plan, we can create the innovation in the market. Self-funded plans created smoking cessation programs 30 years ago. An employer has a different ROI on member health, because why? It's an employee. You've trained them, you've invested in that person for their skills and their set. They want a different return on their investments, where a health insurer may go, I don't care if you wait in that doctor's office for 3.5 hours, I got it for $50, you know, where an employer may go, I'll pay $100 if I can get them back in an hour, and they can just go on their lunch. It's just the metrics of how do we really manage ROI on our plan over time. And I do think AI and the future of generative AI can really be impactful there.
Because there's a difference, right? With, I mean, some people kind of think about like the ChatGPT AI, and then, you know, see some of these point solutions now where you're talking like with a robot and it's replacing the human. So any thoughts on kind of the differences there and how those might impact the future?
So I would say how insurers use AI is yet to be seen. I mean, we're not known as the most innovative group in the world, but we are trying to make inroads here. And I think that the future looks like how we manage submission flow, how we can turn things around quicker for our broker community, and how we can evaluate claims to the things that Jay has mentioned on an aggregate level and kind of feed that back through market reports and helping to educate the employer groups.
I've thought about it as like, you know, and I'm not a data scientist, right? I'm going to probably condition my response accordingly, but, you know, machine learning right now offers a lot of efficiencies to insurance underwriting, right? It's about accuracy, speed, outcomes, predictability. Like machine learning is especially in the operations side, is really, you know, providing all of us benefits and cost savings that we can pass on ultimately to policyholders and members. AI is the ability to access existing data sets to provide indications. And I think we're getting close to that. If you look at some of the specialty vendors, you know, claim clearinghouses and risk scoring and so forth, I think that we're in the initial stages of that. Generative AI is when the black box can really make some decisions, right? Can really look at corollary impacts from a variety of different data sets. I think that's certainly the way that, you know, everything is going, but specifically insurance. Like I think that the power of generative AI, that we'll see that play out in terms of, you know, real benefits over the next several years. But obviously areas that as an industry, you know, we have to watch and make sure that we're getting the right type of indications, and we're not, you know, these machines aren't going to take over the world, and we're not getting unintended consequences in terms of how we're going to look at claims information or how we're going to look at plan design. But I think it's a if you look at broadly, stop loss insurance is a relatively low frequency but high severity type of insurance, right? If you look at auto insurance, it's just the opposite. It's high frequency and lower severity. But when you look at specialty insurance, again, you know, moderate frequency, high severity, we're still at the point where, you know, I'm comfortable with a human set of eyes looking at that clinical information, you know, and making a judgment before the rates and factors go out the door. So that's the area where generative AI could have an impact in the future, but as an industry, those tools probably aren't at our fingertips right now.
See, and I'm still a firm believer that we will always have a human in the loop.
Yes.
I don't think for risk selection or for anything that really drives that, I don't know if generative AI will get us there. I think it's going to be very difficult to replace human decision making. But what I view it as is more of the machine learning generative AI can feed it for decisions, but you're still going to have that human processing going, hey, does this sound right? Mm-hmm. What was this AI trained on? And you know, we've seen it as underwriters in the back of going, the rate just doesn't look right. Well, why is it not right? Well, and then you can start going back. Mm-hmm. If we get too much reliance on generative AI or AI, we'll miss that. Right. And I still think we're going to have that process. So I know everybody, you know, if you listen to Wall Street Journal or some of the other pundits, you know, they say, oh, we're going to replace, you know, 90% of the white collar jobs with AI. Okay, I'll take the insurance sector and say maybe it's not quite so impactful. I still think there's still underwriting skills that have to work. There's still some human skills that are not replicable.
Yeah, it's a mix of the art and science there, which I've said to every underwriter I've ever trained, and that it's, you know, you can't go on autopilot. You need the critical thinking. The machine can't do that for you, no matter how many tools we give them. So I agree with you, Jay, there.
And I would add to that as well, just the importance of the relationship. And just the multitude of relationships in the industry involving underwriters and how critical those are. And in fact, I would argue in an AI world, that's probably even more important potentially in the future than they are today. And if you take the human out, I think you'll lose a lot of that relationship element.
Yeah. And perhaps it's not just the underwriter, right? It's the market-facing people. Like,
your claims.
if you're making a change in your plan design, you're making a change in your networks or TPAs. You want your trusted resource, your trusted service provider, somebody that's giving you insight and ideas. I think we never want to position prospects and policyholders and members on their own. So whether you're market-facing, whether you're underwriting, whether you're operations, or you're working with groups in terms of vendor selection and how to control their costs, that term human in the loop, I think that's really important to think about. Who knows what the future brings in terms of generative AI, let alone AI, but that concept of having trusted resources and advisors, especially when it comes to our ecosystem, is really important.
I mean, there's a million skits out there when you're trying to call a company and you're on that number and it tells you to hit this number and that number, and you just want your question answered and you can't get a human. None of us like that, right? So that can't be replaced, that connection, that human connection, it just can't.
But I would tangent for a second because I want to hammer home on a point that was made, but that this is still ultimately a relationship business. 100%. And you're never going to replace that. And let's be honest, we can program everything, we can have it tested 9 different ways. Something's going to break. So what are we going to do when it breaks? And again, I look at self-funded plans, and again, I view this as a critical role of stop loss, along with everybody who's in the chain of going, sometimes things don't happen the way we expected them to. How are we going to solve it? Because the employer can't be stuck out on the side for it. We're all part of this. How do we come together? How do we find the solution that makes it whole? And I think that's, again, a real art of our business that never will be replaced by AI.
And sticking along the human side of the business, going back to the market report the QBE put out, Tara, there was a clear connection between modifiable risk factors and the increased incidence of cancer cases and chronic disease. So what would you say are the kind of societal risks that we're facing, the employers kind of are dealing with as they're trying to help improve the health of their employees in society today in America?
I think we need more than 5 minutes for this one, but if there's a number of factors that are contributing to our health as a society. We're pretty fast-paced here in North America. I was actually in New York last week and working from a restaurant before I went to a meeting, and a woman tapped on my shoulder and told me I was intense and I needed to calm down and watch some sitcoms at night.
Wow.
But I stopped because I thought, I'm not even talking. I'm just sitting here having my coffee. Wow. And she's picking up that energy. And I think we're all doing that. We're all moving at this pace. And what are we doing? We're eating on the go. We're eating processed food. So if I had to pick one thing, I would say that it's the sedentary lifestyle, the pace we keep, and our diet, right? So there's a statistic that's like upwards of 50% of the American diet is ultra processed foods, which is, if we're talking about my teenagers, it's probably 80%. But 80% of that food has questionable ingredients. I know that current administration is got a ton of focus on this, right? Whether that remains, if there's a change in administration, it was yet to be seen, but I think we need to do a lot of work here. I think disease starts with inflammation in the body, what's happening with our microbiomes. There's a big research study that's going on now. I recently read something about a term called exposome, and it's what you're exposed to, but also your biology, right? And your biology is really only such a small piece of what's triggering the cancer. It's depending on the study you're looking at, it's anywhere between 80 and 95% environmental, and not just what you're eating. But I think if we could look at one thing to impact, it would be the American diet. And how we get there, it's beyond my pay grade, but it is something I think that we all need to look at. Yes, we're reinsurers, to Jay's point, we're at the end of the claim, but from how employers educate their employees to taking care of themselves. We've tried this for decades, preventative care, but I think we need to look at it differently and faster than we have, because I think it's critical at this point.
Yeah, it's one reason I love this industry, because people spend most of their time at work. So if you're running a business, you have a huge opportunity to impact the health and well-being of employees. And you know, sometimes it's seen as a burden, like, oh, I got all this stuff to manage, I'm trying to, which it is, but it's also the opportunity to positively impact people. If you, like Brad was saying, like, it's work, but it's worth it. Like, you are impacting people's lives and their whole families.
If you're impacting like their mental illness, right? If they're stressed out at work, what are they going to do? They're going to go stop and maybe have a drink. Maybe they can get some takeout. If you're creating and cultivating an environment where you see the whole person, they're going to show up healthier for you and more productive for you. So they do gain benefits, the employer groups, by pushing kind of, you know, that healthy lifestyle onto their employees. It's not easy, but I think that they have more power than they think.
Mm-hmm. Yeah, 100%. And thinking about healthcare too, I mean, one of the elements of living a healthy lifestyle is access to healthcare, quality healthcare, accessible healthcare. Jay, I wanted to ask you, I know that you are passionate about direct contracting, and that is kind of a trend in our industry. We're seeing a lot more opportunities for employers to do direct contracting. What opportunities are out there, you think, for employers to increase healthcare accessibility through something like direct contracting?
I think direct contracting really is focused on, to me, it's that next iteration of what's happening in the market. I think when I look at people who currently are running facilities, medical facilities, hospitals, they're looking and going, we have 4 or 5 major payers. They're looking for a diversification in their payer strategy. I think local employers are looking for opportunities to kind of say, how do I make a direct contract with that facility? And then it kind of goes back to what we are looking for is that, hey, if I'm living in, let's say we're in Chicago, we're in a major metropolitan area, there is a better cancer hospital. Great, I want a direct contract with them for cancer. Is there a better organ transplant or a better ortho facility? I want to go to that facility and have my direct contract there. I want to pick based on where I think I get the best outcome at the best price versus, oh, this is just the big hospital system. They've got a commercial agreement. You know, everything has to go there, because that facility may not be the best, may not be the outcome. I think we get into this fallacy, and as imperfect as we are in insurance is as imperfect as they are in medical care. You know, it's not an exact science. It's not 1 + 1 = 2. There's a lot of variables, and sometimes things just happen. You know, we've seen that. And that's where I think, so as we talked about the growth of captives over time, I think we're going to see a significant growth in direct contracting. I think the facilities are primed for it. I think they're looking at it. They're looking at it as a way to gain market share within their markets. And I think it's a prime opportunity for self-funded plans, and especially captive programs that can aggregate lives together, to come back and leverage on those for the benefit of the plan.
I mean, the ability to impact the employer's spend, but also the employee's health outcome is a win-win for both.
And this next question is for anyone to answer. As we think about going into the 1/1 renewal season, how do you see kind of the traditional, like, hard market, variables that come into play, and how that might impact 1/1 this year and in the future? Who wants to take it?
So I'll take that one right on the chin. I mean, let's be honest. Medical costs since beginning of 2024 have really escalated. This is going to be a tougher renewal season than it's been. You know, Steve mentioned, you know, we're to the highest loss ratio as an industry that we've seen in a long time. But I would also counter it a little bit in that we're also a larger gross written premium than we've ever been at $40 billion. We remember the days when, we were an $8 billion market, and we were really, really specialty and niche. But I do think as the market is developing, costs have gone up. We're coming out of a period of a soft market. During COVID, claims went down. Post-COVID, they're coming back up, and they're escalating fast. We're paying for that now, and cost will go up. But I also think there will be reward for employers who get more aggressive than maybe they've been in the past couple of years. There will be rewards for those who try to do something different. There will be rewards for those who say, I am going to impact, and I'm not going to go with what I've done for the past 4 years. I'm going to change and try something new. There will be rewards for that. That's also where I think captives create a huge opportunity for that.
Yeah, I mean, a hard market obviously is disruptive, and nobody enjoys it, from the employer up to the medical carriers. It's challenging, but I think it is necessary right now for the industry, for sustainability. But with disruption becomes opportunity, right? And to Jay's point, trying to look at things, you can't keep doing the same thing over and over. That's the definition of insanity without getting a different outcome, right? So I think we need some stabilization there coming out of the pandemic. We're all seeing it, so it's not unique to one or two players in the space. Tightening terms is probably something you'll all see more of, and what that will lead to. Sometimes that's what happens first before the rates really harden. But it's been quite a few decades since we've really seen things turn this quickly. It'll be interesting to see how things play out.
And I agree with the word tightening. I don't agree with the word hardening. Hardening implies that it's not available. It is available. There's not a restriction. We haven't seen a mass exodus of carriers in the market. Everybody's still here. This is just a tightening of the market as we adjust the price.
And I think maybe to pick up on the word opportunity, right? I think a hardening or a tightening market, I think that creates opportunities for captives and the captive market in general. And a big part of captives is the value proposition around reducing volatility. And when you're in a market that's hardening and you see more volatility, I think that shines a light on the value that a captive solution can provide.
Yeah, it's interesting. It's a tightening market for sure, right? And I like that term better than a hardening market because there's plenty of capacity out there. But it's a bit of a perfect storm, right? If you think about the cost of claims is up, utilization is up. People are using their plans, more often, which is great, right? We want to make sure that people use their plans to get those, claims when they're smaller, as opposed to, letting them go unabated and unattended and have them be large claims. And we also have loss ratios up. So it's a bit of a perfect storm. But the opportunity to pick up on the comment that the captives bring to the table, it's a safe harbor, right? It's an opportunity for groups that have good experience and they have engaged stakeholders, whether it's the CFO or the HR and the broker, to be able to say, hey, we recognize what's going on in the marketplace right now. But a couple of things happen in a tightening market or hardening market is that you have groups that need their trend increase or their leverage trend increase on the stop loss product. But you also have like the cornerstone of remediation or the cornerstone of a hardening market is that technical rate needs to come up with the carriers, whether you're fully insured or whether you're stop loss, right? So it's the double whammy, right? I have this trend increase and I also have this marketplace remediation impact. And again, member-led captive opportunities are the safe harbor for an engaged stakeholder to come in and say, hey, I've managed my plan well and I want to ideally position my plan for the long haul as opposed to the current market dynamics. I want to have a voice in what type of PBM we have. I want to hear from other members and like-minded groups. I want to be in a position to be able to look at plan design validation, to look at network discount validation. I want to be engaged. Like I think Jay had mentioned that, no CFO probably got into the business of making widgets, to look after health insurance. But they got in the business to make sure that their employees were engaged and happy with their health plan. So it's really about sustainability.
And I do think there's a key to your comment there, Steve, is that a captive won't make a bad plan a good plan. Yeah. It is about engagement of that member and what they're willing to do. That's the secret, and the captive, for lack of a better term, greases the track or facilitates that engagement.
I do think this market also calls for a flight to quality, right? So if there's volatility and employers don't know what to expect with their rates, they do want to know that they're going to be with a carrier that's going to pay their claims timely and consistently. And I think that in a market like this, you'll see kind of the cream rise to the top.
Awesome. And as we close out, I want to hear from each of you as we look into the future of 2026 and beyond. As we've said, captives are gaining momentum and steam. What do you think are the biggest drivers of growth in the captive space, and what do you think motivates employers to really, or brokers, to challenge the status quo and to try something different here?
We're all quiet.
Yeah, well, hey, I think I'll start here. So for me, it all starts with outcomes. And as the cost of healthcare continues to rise, everybody's looking for solutions. And they're looking for opportunities to control their costs within their health plan. And I do think as you look at the marketplace, people look at captives as a really viable, strong solution to do just that. And so it starts with the outcome in mind, the pain point that a lot of employers have, and this being a solution to help solve their challenges. So that, to me, I think that's a big part of the growth drivers.
I'd say I'm just really passionate about what's happening with our health and, you know, what's causing these claims to go up. And so just having employers that are really focused in and they want to dig their heels in and say, I've had enough. I want to impact change and maybe be less reactive and more proactive. I talk about this a lot with at the point we're seeing the claim, there's not much that can be done about it. So like a proactive, health cultivation as opposed to reactive, like medical consumption of care. Like we can't buy our way healthy, right? We can't put enough TV ads on about what the latest pharmaceutical pill you can pop to fix things. Like we really just have to get back to the fundamentals of taking care of ourselves. And that starts with educating our employees.
Yep, and the work is never done, right? Like you said, your employers that are passionate and they're trying to be more proactive. Maybe they've tried things, they didn't see the results that they wanted, but nobody has cracked the code on behavior change, right? Like it's an evolution of, meeting people where they are and helping them and supporting them, and technology is changing. And so
unless every employer group out there decides to hire a biohacker to educate their employees at lunch, I think you're right.
Yeah, I mean, and again, that's a new evolution. That's a new strategy or a new technology. So yeah, just keep evolving the process and keep working at it.
So I think, and I've said and this is what I'm educating my staff on, is that I think we're at the preface of such a monumental change in this business. It's going to be facilitated by data and just engagement that we're going to look back in 5 years and go, I can't believe we used to do it that way. Mm-hmm. I can't believe we used to think that way. And again, it won't be one major step. It's going to be all these series of little steps that we see along the way. We're seeing it with the technology that's coming out. Again, we're seeing more specialty care programs coming out for every minute disease state where somebody is specialized in that disease state. Mm-hmm. So how do you now create the tech that incorporates all of them into one plan? I think that's where I'm excited about the business. That's where I think the business is going to grow tremendously. My career will be over before this business reaches where that pinnacle is, but I think the next decade is just going to be an absolute screaming race to what we can do with technology, data, and information, and really improve health outcomes and what we do and how we finance it. So I'm terribly excited about it and think it's a really bright future.
Mm-hmm. Agreed. Steve, you want to bring us home?
Sure. First of all, thank you. Really appreciate your time and your insights. And the future is incredibly bright. And it's a lot of it has to do with the January underwriting season, but there's a lot of headwinds in the marketplace right now in terms of cost and utilization and plan design and cost shifting. So I'm really excited about the business because there's a lot of headwinds, but there's a lot of tailwinds too, right? There's a lot of great levers and insights and ideas out there that really can help employer groups contain cost. I personally believe that the mechanism of the captive from a risk structure standpoint, but also a mechanism to facilitate these ideas, a mechanism to be able to maybe a bit of a test kitchen or ideas to whether it's certain point solutions or network optimization, direct contracting. In terms of where we are as an ecosystem of self-funded entities, I think captive stop loss, specifically member-owned captive stop loss, is a mechanism that facilitates these great ideas. We talked about the onset of this conversation about like-minded individuals, collaboration, facilitation of ideas. There's a lot of really effective solutions out there, but at this point in time for small to medium enterprises, I think that the captive structure, really almost independent of the risk design, just represents employers and brokers the right forum to facilitate these ideas and ultimately engage and implement.
Well, that was an awesome conversation. Thank you so much, everyone, for joining us today and talking all things stop loss. I think we hit a lot of awesome points here, and it's going to be really insightful for all of our listeners. So thank you so much again for being here today.